Welcome to our in-depth guide on non-surgical hair restoration, a growing trend for those seeking to combat hair loss beyond medical intervention but without undergoing surgery. In this video, we will explore various non-surgical options like growth factors and PRP. We'll guide you through the benefits of each treatment, what to expect during the process, and the essential post-treatment care tips. Additionally, we will cover potential side effects, pros and cons, and debunk common myths and misconceptions. So whether you're looking to thicken your hair or to prevent further hair loss, this video will equip you with all the information that you need to make an informed decision. Stay tuned for expert insights, comparisons, and practical advice on maintaining long-term hair health through non-surgical methods. Why did non-surgical hair restoration procedures become so popular? We know that topical Minoxidil and oral Finasteride are the only US FDA-approved therapies for androgenetic alopecia, and they have been so for many years. They work brilliantly as well for most people, especially when they are given in combination with each other. And yet they are becoming increasingly unacceptable to many due to their many side effects. Some of the side effects are real and some other are perceived. The results only last for as long as you're using them, leading to some disillusionment and increasing interest in exploring other options. Then there will always be a subset of patients who cannot tolerate Minoxidil or Finasteride or are contraindicated to use them. So thus there was a scope and a market for something new and something different. There are many different types of non-surgical hair restoration therapies, and for today's discussion I will be limiting myself to a few procedural interventions only. One, there is something called LLLT, low-level laser therapy. So these come in the form of either home devices like handheld laser combs or in-office devices like a laser helmet or a laser hat. The technology received US FDA approval in 2007 and is said to work by promoting anagen-phase re-entry of telogen hair follicles. Then there are PRP treatments, also known as PRP hair restoration. This has received a lot of attention by the media, by medical community, and by general public at large. The treatment itself is not new. It has been used for a very long time by multiple specialties for treatment of non-healing ulcers, arthritis, radiculopathies, burns, and tendon injuries. But its use in cosmetic dermatology is less than 2 decades old. This therapy has been used to treat hair loss and hair thinning. Less popularly, it's also used for skin rejuvenation and the treatment of post-acne scars and pigmentation. When performed correctly, the results are highly encouraging. Have you ever noticed how your skin can heal itself after a cut or a wound? The wound will bleed and then it oozes for a few days and then you see fresh tissue forming to seal up the wound. So the PRP treatment draws on your body's innate ability to be able to heal, repair and rejuvenate. The treatment involves drawing about 16 to 30 ml of blood from the patient, running it in a centrifuge to separate the solid red and white cells from the liquid part, which is the yellow plasma. The plasma contains the platelets, which are then activated either by centrifuging or passing it through light, which releases about 15 to 20 different growth factors. The growth factors promote healing, hydration, formation of new blood vessels, and regeneration of tissues. The plasma is then injected into the scalp with multiple very superficial pricks. Numbing creams and vibratory devices are used to make the treatment comfortable. The treatment has no side effects when it is done under sterile conditions. GFC treatments, which is a variation of the same concept, also requires drawing platelets' own blood and extracting the plasma. However, in this case, specialized designed kits are used to prepare a concentrated growth factor preparation from the patient's blood cells. The treatment works well even on patients who have a somewhat lower platelet counts. GFC therapy kits contain a platelet activating solution. So they are designed to extract growth factors from the patient's own platelets at higher concentrations. GFC treatments are less painful compared to PRP treatments and the results have been very encouraging. So lately GFC treatments have become slightly more popular. This treatment also requires about 3 to 6 sessions, usually done at monthly intervals. Both PRP and GFC work well after hair transplantation as well, to encourage faster hair regrowth and to improve the surgery success rates. Then there is PRF, platelet-rich fibrin treatments, combined with derma roller treatments. PRF is a more advanced version of PRP. It is created by centrifuging the blood to obtain a fibrin-rich matrix that contains a higher concentration of platelets and growth factors compared to PRP. So PRF is considered a more robust and longer-lasting solution for hair restoration. PRF formulations contain a more denser concentration of platelets and growth factors, so it can show results in a fewer sessions. A derma roller device is used initially over the scalp to stimulate the natural stem cell production in your scalp. PRF treatments can be slightly more painful as the formulation clots very quickly, so it needs to be injected very quickly and very rapidly after the plasma is separated in the centrifuge. Contraindications to PRP, GFC, PRF, basically any of the treatments where we have to draw the patient's own blood, is people who have active scalp infections, autoimmune diseases, low platelet count, chronic liver disease, chronic skin conditions, or people with bleeding and blood clotting disorders. So in some of these cases where I do not wish to use the patient's blood tissue for the aforementioned reasons, I have lately been exploring another non-surgical hair restoration therapy called QR678 Neo. This is a bioengineered recombinant formulation consisting of a combination of growth factors and biomimetic peptides. This formulation is also injected into the scalp using a mesotherapy Napaj technique. It does not involve any blood draw and it can be done without using any anesthetic creams. It is an Indian FDA approved formulation which has received Indian and USA patents. Efficacy has been demonstrated in a few studies and it is already being used in about 10 different countries. Although it has shown efficacy in various male and female pattern balding as well as telogen effluvium, which is excessive hair shedding which is seen after an illness or because of stress or post-delivery for instance, it has also shown efficacy in hair fall that is caused by drugs or chemotherapy. So in medication-induced hair fall, rather than using the patient's own plasma, which is probably still carrying that medication, I would prefer to use the QR678 formulation. This treatment requires about 6 to 8 sessions done on either a fortnightly or monthly interval, depending on the indication being treated. For those suffering from balding, and balding is controlled by factors like genetics and hormones and aging, and none of these factors can be permanently reversed or rectified. So maintenance sessions may be needed every 3 or 4 months or so, irrespective of the whichever treatment that I'm going to choose. You may experience pain and swelling for a few days post-treatment, but basic painkillers like a paracetamol can keep you comfortable and can get you ready to get back to work the very next day. Oral antibiotics are usually not necessary after the treatment. But since the treatment does involve multiple needle pricks, your doctor may recommend that you use an antiseptic shampoo for a few days after the treatment, and the treatment must be performed at a medical facility under aseptic precautions by a qualified dermatologist. There is usually not much need to restrict any regular activity post the treatment. Just take care of maintaining your regular scalp hygiene and avoid using hair oils as styling or grooming products for a few days post-procedure. There is no one perfect treatment, so we discourage patients from reading random online research or online feedback and demanding one particular X treatment, that you do this treatment for me. See, the treatment choice begins with a history, followed by preliminary diagnosis, followed by investigations, then we make a final diagnosis, and then we make a treatment plan which is chosen for you depending on your needs and tailored as per your diagnosis. Results for hair is always gradual, it's not always guaranteed, but the results with these treatments are always natural looking. Correct treatment, a technique and proper understanding of the science is pertinent to excellent results. Procedural intervention does not replace the need for day-to-day medical management that is to be followed diligently by the patient at home. So patience and persistence is key. What are the many myths and misconceptions surrounding PRP treatments? One myth is that PRP treatments are very painful. Actually, PRP treatments do not require any local anesthesia or sedation. They can be comfortably carried out and performed using just a numbing cream or other pain-relieving techniques like using a vibratory device or something like that. Myth number 2, PRP treatments are only for men. No, actually PRP treatments can help in male and female balding, cases of excessive hair shedding called telogen effluvium, medication-induced hair loss, traction alopecia. They are less successful in alopecia areata and they do not work at all for scarring alopecias. Myth, PRP treatments will deliver instant results. No, the fact is, although some patients may see an improvement in hair fall after the first session, PRP usually requires multiple sessions to regrow hair. Unlike Botox, fillers, laser hair reduction, results with PRP and GFC are not always guaranteed. Myth: PRP treatments are a one-time deal. No, the fact is balding is an ongoing and eventually irreversible process. So you will require maintenance sessions to sustain ongoing hair growth.